The best candidate for a treadmill stress test is really anyone that the physician feels like might have coronary artery disease. So coronary artery disease is certainly one of the more common causes of chest discomfort or exertional symptoms. Ultimately, it's the diagnosis that's being referred to cardiologists to evaluate for most frequently, and it's still the #1 killer of Americans. And so ultimately, a failure to make the diagnosis of coronary artery disease is a big deal. We're looking for what your heart rate does with exercise. Some patients don't have the ability to augment their heart rate as they exercise, so we get information on that. We look for your blood pressure. Your blood pressure should normally increase gradually with exercise, and the failure to do so is actually quite a high-risk feature. If you're referred for a stress test at the Parkview Heart Institute, what you can expect to find is you'd show up, typically early in the morning. You'd be checked in at the front desk like normal. Depending on the type of testing being performed, you'd potentially have an IV started. If you happen to be a male with a fairly, a lot of chest hair or something, they may have to shave off some of that chest hair to allow for the EKG pads to stick appropriately in the right places. And then essentially you'd have some blood pressure measurements taken and taken back to one of the stress labs, at which time you'd have an exercise treadmill tech, potentially a nuclear tech who would inject the nuclear tracer if needed, and then a nurse and plus or minus a physician at times, depending on the risk and whether you've seen a cardiologist previously and that kind of thing. And so basically what we would be asking from you is to give your best effort on the treadmill, to walk as far as you can, and we would be monitoring your blood pressure throughout the test periodically, about every 2 to 3 minutes. We'd be checking your EKG continuously. The treadmill tends to get a little steeper and faster about every 3 minutes or so, versus a vasodilator or a chemical stress test where you basically just lay in the bed and they inject you with a medication that can make you feel a little uncomfortable, but it's a fairly short-lived medication, of response of 2 to 3 minutes, and then patients tend to start feeling better after that. Afterwards, we would either interpret those, in the afternoons, or you'd be taken for additional pictures, and those studies would be read out that same day, and you could expect to hear back from your providers within the next couple of days. Stress testing is easily one of the most safe things we do in the Heart Institute. Certainly you're heavily monitored. You have highly trained personnel at your side the whole time. You have more personnel, to include a whole clinic full of cardiologists that can be there at a moment's notice if something terrible were to happen, which is extraordinarily rare. And ultimately, it's, because the diagnosis is so important to make, in this situation, the benefit of undergoing this kind of testing when appropriate far outweighs any risk to you as a patient.